Thank you. Good morning, and thank you again for joining us. This is a very happy day for us across Northern Light and for the state of Maine as we have begun to start our vaccination clinics to protect our healthcare workers against COVID-19. But before we discuss in depth that good news, there's a grim reminder that we need to have that this pandemic is not over. The state of Maine reached another milestone with a record number of individuals testing positive for COVID-19 in the last day. And we have seen an increase in the number of individuals being admitted to our hospitals due to complications of COVID-19. Currently, across Northern Light Health, these are our current numbers. There are 64 inpatients in total in our system, with 36 of those being at Eastern Maine Medical Center, 2 at A.R. Gould Hospital, 2 at Blue Hill Hospital, 3 at Inland Hospital, 3 at Maine Coast Hospital, 3 at Mayo Hospital, 11 at Mercy Hospital, and 4 at Sebasticook Valley Hospital. In addition, we have 17 people who are being cared for by our home care and hospice workers at their homes. So that's a tremendous increase in numbers. Those of you who have been coming to these briefings over the past months know that I rarely talk about that many hospitals in our briefing. This should be a warning sign to everybody that this is widespread. It affects every community in the state of Maine, and we all need to remain vigilant and remain determined to beat this pandemic by doing the things that we have been preaching for months now. We need to be wearing those face coverings when we are outside our homes. We need to be staying 6 feet apart when we are in with other individuals. We need to be practicing aggressive hand hygiene, washing our hands frequently and sanitizing them. And we need to remain away from gatherings of more than 5 people, particularly those outside our own households. We know this is the major cause of spread right now across the state, and we need our healthcare workers to stay healthy, and we also are part of our communities, and so we need you to help protect us so we can stay here. We are ready and open to continue to take care of any of your health care needs, and we feel that we can do that safely and effectively. And with that, the next stage of the pandemic has arrived, where we are now vaccinating our healthcare workers in order for them to stay healthy so that we are here for you. This morning at 6:30 in the morning, Eastern Maine Medical Center started its first vaccination clinic. We are happy to report that as of this moment, we have vaccinated over 125 of our employees and providers to help protect them against COVID-19. This will be a long process. It will start with vaccinating our healthcare workers across the state, and we are happy to report that at least 2 of our other hospitals will start vaccination clinics shortly. That will be at A.R. Gould and Mercy Hospital. We expect that next week, if all goes well and emergency use authorization is granted to the Moderna vaccination product, that we will be expanding those vaccine clinics for our healthcare workers to our other facilities as well. For the community at large, we know this is going to be a slow process. We want you to be patient. Your time is coming, but it may not be that soon. Right now, the expectation is for us to start vaccinating beyond healthcare workers, those who live in congregate living situations like skilled nursing facilities and long-term care facilities, and their staff will probably not begin until after the new year and may not be until as late as February or March. So please be patient with us as we go through this process. Please be understanding. But again, this is a bright day, and we finally can start talking about that we can see the light at the end of the tunnel for this pandemic. I'll turn it over to Paul for some other comments about our vaccine process.
Thanks, Dr. Jarvis. So as Dr. Jarvis mentioned, we started our employee vaccination clinics today, and it was delightful to see the first 2 recipients sit socially distanced in a room, a CNA from one of our patient care units and an emergency department physician, both receiving their vaccine as the first 2 in line. It was a moving moment, and I know a lot of effort has gone into this process, not just within Northern Light, but getting the vaccine here and ready to be used. And we certainly anticipate having our vaccination clinics continue and paced to use the vaccine as quickly as possible as soon as it's received, and are looking forward to that collaborative effort in that vaccine distribution with the state and federal CDC.
Thank you, Paul. As Paul mentioned, this has been quite a process for us, with lots of individuals partaking in setting up the operations for these clinics. As I said, they will be ongoing for a period of time, and so we all should remember that. This is not just for Northern Light, this is for all of Maine. We have had many collaborations across our enterprises. We are delighted with the way that Governor Mills has handled this situation, and we respect her executive orders for people to continue to wear face coverings when out in public. We have had new partnerships. In fact, the University of New England has recently started a program where it is helping to train some of their students to assist in vaccination processes, and we will be utilizing that service here at Eastern Maine Medical Center. That is just one example of the collaborations that are going on in order to make Maine and keep Maine healthy. So with that, we'll turn it over for questions.
Thank you very much, Paul and Dr. Jarvis. I do want to make one quick note to members of the media. And you may see this or may have seen this in the chat box down to your lower right. We do have footage from today's vaccination clinics at Northern Light Mercy Hospital and Northern Light Eastern Maine Medical Center. It's going to be in that same Dropbox location that the press conference will be made available to later, if you have interest in that as well. So with that having been said, I'm going to start with questions, and we'll begin with Dustin Bludkowski from NBC Boston. Dustin, as soon as you see your microphone unmuted, please feel free to ask your questions.
Thanks, Chris, and thanks, everybody. The first question is, what is your testing capacity ahead of the holidays next week? Have you seen a spike in demand at Northern Lights COVID-19 testing sites, and what are your wait times right now?
So Dustin, that's a great question. It's asking about our testing capacity and what delays we are seeing. So I will say that we continue to keep up with demand as best that we can for testing. Testing demand has increased, and we have seen the number of cases of COVID-19 increase, which means that there's more community spread, which means there's more community concern. We continue to maintain the ability to test when we think that it is clinically necessary. So therefore, testing those people who are symptomatic, especially those where we think treatment early on will be helpful in the course of the disease. And so we are able to do that. I will say we continue to struggle, though, because of the sheer volume and the fact that some of our resource testing sites, testing centers, have delay in turnaround times. We ask for patience for people, particularly if they're getting tests for asymptomatic reasons, such as travel. Again, we kind of caution that travel right now should be very limited in its scope, and people should take caution about congregating outside of their own household. And so using a travel test in order to say, hey, everybody is safe so we can all be home for the holidays is just not an effective tool, and we've seen that fail over time and time again. Again, we're able to keep up with demand as far as our clinical needs go, but there is a delay in particular for those who are getting testing for asymptomatic reasons.
Hey, Dustin, do you have a follow-up question?
I'll just jump into the next question, and if anyone has a follow-up to that, they can ask. That was fairly thorough. Thanks, Chris.
Okay, thank you, Dustin.
Looking ahead, what are your expectations for the winter and preparing for what could be more COVID-19 cases across Maine?
So we have been preparing for a large number of patients' influx into our acute care facility since the beginning of the pandemic. Very early on in these briefings, we talked about our staging plans for surges. Those have always been on the back burner for us. We were very fortunate in the state of Maine during the summer months and the early fall, but now we're utilizing those surge plans. So each and every day, every department of every one of our acute care facilities is reviewing their surge plans, looking what capacity they have right now, looking at staffing, and looking at the number of COVID-positive patients they are currently dealing with, and then adjusting everything based on a pre-planned surge plan process. It has worked very well for us up until this point, but we are concerned. If the numbers continue to increase in hospitalizations like they are right now, Christmas morning could be a devastating time for Mainers because there will be limited number of beds. One thing that people should remember is that for every patient that's admitted to our hospital with COVID, that's a patient that normally we would not have in our hospitals. That is one less bed that we have for people who have heart attack, stroke, pneumonia, or any other medical condition require hospitalization. So if those numbers continue to climb, we will have problems with capacity. At the same time, we also see spread out in the community of our own healthcare workers, which limits our number of staffing. So this is a great opportunity to remind people, please wear your mask, please stay 6 feet apart, please wash your hands, and please don't gather in large numbers. So thank you for that, Dustin.
Okay,
Thanks.
Thank you very much, Dustin. We're going to move to TJ Tremble now from Fox Bangor. TJ, as soon as you are unmuted, please ask your questions and let us know who you're directing it to, I should say as well.
Thank you, Chris. This is for Dr. Jarvis. Of the 125 or so who have taken the vaccines, received the vaccine so far, have any of them exhibited any sort of negative reaction to it?
So the question was, has anybody that have been vaccinated so far today had any negative reaction? I am not aware of that. That may be the case, but I do not think so. As the incident commander and the operations section chief for our vaccine program, I would have been alerted, so I do not think that is the case at this time. In fact, I just left the clinic before coming here for this briefing. People's spirits were high. Physicians stopped me in the hallway who had just received their vaccine to, one, congratulate us on this effort, and two, say the process has worked smoothly. For overall, the joy, the mood in the room is joyful, and we're appreciative of that. But we will continue to monitor for people for any indication of problems, just like we do with any other safety concern or any other vaccine. But frankly, this is a very safe vaccine. We don't expect many problems.
Thank you, Go ahead, TJ.
That's all right. And by the end of the day, do you expect the 125 number to be double, triple, as far as those vaccinated?
Yeah, TJ, that's a great question. I really don't have an answer for that. Our goal today was actually a modest one of only vaccinating about 65 to 75 individuals, but things have worked so well, and our pharmacy team has been so efficient at being able to protect this particular vaccine that's allowed us to just continue to vaccinate those individuals who are on our front lines who want to get the vaccine. I expect that we will probably be talking about numbers over 200. I don't know that for a fact, and so we'll know a little bit more at the end of the day, and we'll certainly let the press know.
Thank you very much for those questions, TJ. We're going to move on now to Marissa Bodner from WGME. Marissa, as soon as your mic is unmuted, please feel free to ask your questions.
Hi, Dr. Jarvis. I know you just mentioned capacity and, potentially getting to a point where beds are very limited. Can you give us an idea of maybe how close we are to a point like that, where the capacity kind of stands right now?
Yeah, Marissa, that's a tough question to answer, which is, where are we as far as capacity goes? Like I said, every hospital in the state of Maine has the ability to flex up and down based on its community needs, and we continue to do that. My concern is that as we start talking about numbers of 200 or more people needing to be admitted for COVID-19, that's a concerning number for us. If you look at one of the model projections that has us at 800 patients admitted to our hospitals with COVID-19 on Christmas morning, think about that. That would be more than the entire capacity of Maine Medical Center and Mercy Hospital combined. And so that's concerning for us. So we need to continue to work to try to keep those numbers lower until we can have the vaccination widespread to decrease the amount of virus that's out there. Are we concerned now? Yes. Are we in that critical phase? No. But we continue to evaluate, and we need to always all remain diligent.
What do you say to people to really drive that home? I mean, how do you get through to people at this point to, just how important this is?
I'll tell you that my message is the same as it was when we first started this. If it's not for you, it's for somebody else. If you have somebody that's close to you who is over the age of 65, who is obese, has high blood pressure, heart disease, lung disease, cancer, is pregnant, or is a child, then you need to protect them. If nothing else, we are Mainers and we look out for each other. We need to protect each other, and I will say it again. This is the thing we do to save the state of Maine, to save each other. It is about personal responsibility, it is about community responsibility, and it is about good stewardship of our state resource, the most important one, Mainers. So thank you.
Thank you, Marissa, for those questions. Next up is Patty White from Maine Public. And again, Patty, just let us know who you want to direct your questions towards, and you'll be unmuted shortly.
Thank you very much. I suppose this is for Dr. Jarvis, but whoever wants to answer. Actually, Dr. Jarvis, you said I wanted to double check that you said that vaccinations are going to be starting at A.R. Gould and Mercy shortly. Does that mean today or tomorrow?
So we expect that A.R. Gould will start its clinic this evening. Mercy was going to do a dry run. They may or may not be able to actually administer vaccine today. They are trying to do that. If not, they certainly will be doing that tomorrow.
Okay, great. And can you just also give us a sense, you listed the hospitalizations, the number of patients you're seeing in the hospital currently. Is that the highest that you've seen so far this pandemic, or can you just provide a little bit of context?
Yeah, so I believe that is the highest number at Eastern Maine Medical Center, as well as the highest across combining all those numbers together as a total for Northern Light Health. We can certainly confirm that for you, but if it's not the highest, it's awfully close. Certainly, it's the highest I remember in the last few weeks. We talked about some numbers before Thanksgiving as being high, but we are seeing the after effects of Thanksgiving now.
Thank you very much, Patty. Next up is Amy Brown from WERU.
Thank you, Chris. And this is for Dr. Jarvis as well. Just to follow up quickly on, you said AR Gould and Mercy will start shortly with their vaccinations. Does that mean shortly today or sometime this week?
So AR Gould has a planned vaccine clinic this evening. Like I said, Mercy is running through the process to make sure that they have all their processes in place. If they feel comfortable with that, they will start this evening as well with their clinic. Otherwise, they will start tomorrow morning.
Okay, great. And can you say more about the model that you just mentioned that projects 800 admissions on Christmas morning? Is that something that's available for the public? And does that number represent possible admissions across the state or just to the Northern Light System or EMMC?
That would be for the entire state, and that is an outlier model, and it's the one that we hope is wrong. But hope is not a strategy. We need to plan as if that model is correct. So it's similar like we're talking about with the storm tomorrow. We prepare for 12 to 15 inches of snow, and some of us will actually ask for less. Some will want more. But not in the case of COVID-19. None of us want more hospitalizations than what we have. We want to see less than what we have. So those projections come from both the federal CDC and Maine CDC. Most of them are based off of either the Johns Hopkins or University of Washington data models, and those can be readily found online.
Okay, thank you very much, Amy. Spencer Roberts from WABI. It's your turn.
Thanks. My questions have actually been answered, so you can go ahead and skip me and move on.
Thank you.
Well, that's sufficient. We love that. Okay. Next on, I think News Center Maine is not have any questions. I've been informed, so I guess that means we're really efficient today. We're going to go to Bangor Daily News and Charlie Iacker. Charlie, it's going to take me a second to find you on the board. There you are. As soon as your mic is unmuted, please go right ahead.
Yep. Thank you. I guess just one question, which is, Dr. Jarvis, can you offer just any kind of broad details about what the logistic process was like getting the vaccines sort of into EMMC, and then just kind of what types of equipment was required, and just any kind of general detail on that part of it?
Sure. So actually the process went very smoothly from our end. So the delivery came to us on Monday morning. The package was uncrated. Those of you who might have seen some of the still photos we had, it's not a very large looking package for the amount of vaccine that's there. It was immediately placed into one of our ultra cold freezers where it continues to be stored right now. After that, the process really is similar to what we do with other vaccines, other than the fact that because this is stored at an ultra-cold temperature, it does need to be thawed first, and then it needs to be reconstituted or diluted with saline, and then put inside syringes for individual use. So that process has actually gone very smoothly. If there's one thing that healthcare agencies do well, and particularly Northern Light Health, it's vaccinate people. We vaccinate a lot of people every single day. We vaccinate all flu season long with the influenza vaccine, and if you haven't gotten your flu shot yet, I highly recommend that you do so. And then we vaccinate for childhood vaccines and adult vaccines throughout the year. And so we do vaccination well. So that part of the process was actually relatively easy for us. Much more complex was actually determining who can get the vaccine now based on availability of their work schedule and their availability for their clinic times. We also have to remember that this vaccine and the Moderna vaccine, which we hope will come out next week, both require 2 doses, and they need to be spaced perfectly apart. And so with that, we have to coordinate not only scheduling somebody to get their vaccine today, but in the case of the Pfizer vaccine, their vaccine 3 weeks from now. And so all of that is a logistical concern. I am pleased that the team really came together over the last 2 weeks to really put in place an electronic process for this to be done so we can do it efficiently and safely. There are also some screening questions that have to be taken care of. And again, all of that was built into the process. So thank you for that. Probably a little bit longer answer than you wanted. But there is a lot of machinations that happen behind the scenes that are making this work. And like I said, so far today, knock on wood, we are doing very well in getting the vaccine into people.
Okay.
Do you have a follow-up question?
No follow-ups. Thank you, Dr. Jarvis.
Okay, thank you, Charlie. And I think we're going to move on to Portland Press Herald. It's Kelly Bouchard. Kelly, as soon as your mic is unmuted, go right ahead.
I'm all set. Thank you very much.
Great. Okay. Well, we wrapped it up quickly. It's got to be a record for us. Thank you all for being here for the press briefing today. And again, a reminder that there is available B-roll in our Dropbox link, and if you would like a copy of this, please indicate so in the text thread, or email us afterwards if there's a follow-up you need. Thank you so much for your time today. Have a great rest of your day, everyone.
Thank you, everyone.